So we are joined by Alma Gasca, who is the Associate Director of Prevention at the Alliance of AIDS Services, and is a deep and longtime friend of the Commission, is also a graduate of our Language Justice Leadership Institute at the Commission, and has been really somebody who I text all the time, asking them if I can send them people, and is always ready to answer the call. And she's joined by two of her colleagues, Sergio and Christian, who are prevention specialists at, counselors at the Alliance as well, who will be talking about some of their work. And we're also joined by Saul Sanchez, who is a prevention specialist at the Atlanta Harm Reduction Coalition. So I'm gonna go ahead and pass the floor to the Alliance first, if you'd like to go ahead and kick us off. And we can just do it in alphabetical order, right? So Alma, Sergio, Christian, the floor is yours if you'd like to tell us a little bit more about your program and the work y'all have been up to. And I think you have some slides you're gonna share, so let me make sure you can share your screen.
Hello, everyone. Good afternoon. My name is Alma Rodriguez Gasca, like Jose was saying, and I am the Associate Director of Prevention for the Alliance of AIDS Services Carolina. I've been now with the Alliance for about 6 years now, and I've actually been in the HIV field for 11 years. So that's certainly, been a passion of mine, and working with the agency that I currently work with as a nonprofit. I came from county to nonprofit. It's been a interesting experience, but it's been something where I've experienced more freedom as well. So I really enjoy the work that I do. If I could go ahead and get the presentation going so I can let you guys know more about our agency.
Yes, just one moment while I pull that up. Sergio and Christian, if you want to introduce yourselves, feel free.
Oh, yes. And
Good afternoon, everyone. My name is Christian. I am a prevention specialist for the Alliance of AIDS Services. I've been working with the Alliance for about 4 going on 5 months right now. Again, like Alma was saying, it has definitely been a busy time right now, especially during the COVID, and there's a lot of work to do, and we've definitely seen a lot of clients within the past couple months.
Hi, everybody. My name is Sergio. Pronouns are they, them, and theirs. I'm a prevention specialist as well with the Alliance. I've been here for 2 months now, I believe, but I've actually previously volunteered with the Alliance, and I've previously as well worked within the community as an advocate for various different things, whether it's immigration or other stuff. But right now I've switched over to this, and I'm trying to hopefully make a difference. So here we are today.
So I'll try to make it full screen, but for now, this is what we're able to see. My apologies.
Okay. All right. Well, basically, so who are we? The Alliance has been in existence since the late 1990s. It established itself from 3 different organizations that we previously had. So our official name, of course, is the Alliance of AIDS Services Carolina. In Spanish, the best introduction that we have come up with that certainly signifies a lot of what we do is called La Alianza para la Lucha contra el SIDA. And that's something that, we're really proud of, and in terms of the work that we do, it applies certainly. Next slide, please. So our mission basically is to serve the community through compassionate, non-judgmental support, education, and care for the prevention of HIV, AIDS, and STIs. We are in the process of changing our mission statement along with our vision statement, and that's hopefully going to come within the next couple of months because we're going to revamp the agency. But for now, that's the mission that we've had for the past, more than 10 years, and it's something that we strongly believe in. Next slide, please. So what we do, we're basically dedicated to serving the community by providing the highest quality, non-judgmental care. We do this through our testing efforts, food pantry, CLEAR program, as well as various support groups. We believe that treating people with dignity and love is the best medicine. We also do this through our educational efforts in the 6 counties that we currently serve in our Region 6. So it's, you know, we have a widespread in terms of what we do. Next slide, please. So in 2019, because we're still in the process of gathering our statistics for 2020, but in 2019, we provided almost, 8,600 tests, consisting of almost 3,100 HIV tests. We did hepatitis C, syphilis, chlamydia, and gonorrhea testing as well. In that specific year, we served 7 counties. As you guys can see on there: Wake, Durham, Chatham, Lee, Franklin, Orange, and Johnston. One of the most important things about that is that out of those 7 counties, 5 of them are rural. And so, as a lot of you know, working in prevention and in the HIV field, reaching out to the community and really being able to connect with rural areas has been a challenge. And so that's something that we're proud of, to say that we've been able to penetrate. You know, we still have a lot more work to do, but we've certainly been able to penetrate a good number of areas and obtain a good number of these tests from there. We also have a food pantry that is open to the community and it also serves individuals living with HIV. And that food pantry back in 2019 had 6,445 individual visits to the pantry, and we provided 46 tons of food and supplies to more than 2,000 households. This past year in 2020, we probably saw that number grow because of the need and because of COVID and, the current situation that people are going through, losing their jobs, not having money. So we certainly have seen those numbers grow. Next slide, please. So we do offer free HIV STI testing. And of course, our services are 100% free. We provide blood tests for HIV, syphilis, and hepatitis C. We do a rapid and a traditional test. And then we also do urine testing for chlamydia and gonorrhea. Basically, it takes about a week and a half to 2 weeks for clients to receive their results. Apart from their rapid tests, which we have 2 different brands of rapid tests. We have one that takes a minute to find out results. And that's very convenient for our outreach community testing, for example, in the clubs, if we're at, outside of a Latino grocery store, or we're basically providing community education to the homeless population, then that's something where we utilize that minute test to kind of get somebody a rapid result within a short time frame. We also have the 20-minute rapid test in the office, which is more accurate, but it still falls within the same lines as our minute test as well. And so we utilize those a lot in office and out in the community. During the testing process, clients are educated on HIV transmission and safer sex practices. I'm sorry. During the testing process, clients are educated on HIV transmission, safer sex practices, including condom usage and PrEP. We also try to do pre and post-test counseling, and we also try to provide supportive services for our clients that doesn't just include, services for testing. They may need services to be referred for housing, food assistance, mental health services. So we try to do an all-encompassing effort with our counseling sessions, just to make sure that we can try to assist clients as much as we can. Next slide, please. So what is our CLEAR counseling program? CLEAR stands for Choosing Life, Empowerment, Action, Results. It's a free short-term counseling program for people living with HIV. People are able to refer any clients that they may have to our program. And basically it's anywhere from a 5 to 7 session counseling program that they have, that they meet with a counselor for an hour once a week for 5 to 26 sessions, depending on how much need they have and how much support they require. They can get bus passes to them from the sessions, as well as gift cards as an incentive to remain in the program. What's the benefits of CLEAR? It's learning more about HIV and how to stay healthy, practicing communication skills, and empowering you to be more independent. A lot of our newly diagnosed HIV folks benefit from CLEAR because it also helps them to understand their diagnosis, to accept their diagnosis, and to be able to live with the diagnosis as well. So it's a very beneficial program, and we utilize it and work in combination with our HIV Connection to Care program so that we can refer folks to counseling as well as being able to connect them to care. Next slide, please. Our food pantry, again, as I've mentioned, it's open to anyone in the community that is in need. We don't turn folks away. We don't ask for ID or any type of documentation. We just basically allow them to come in. We put them into our database and they are allowed to shop for food. One of the good things about our food pantry is that it's not only open to the community, but it's an actual shopping experience. Our food pantry has aisles and food carts where we allow people to go around and choose what they want to take versus other locations where they just give you a box of food and tell you, this is what we have. For COVID right now, we have had to construct boxes where we allow folks to do drive-throughs. Sorry, I'm gonna talk slower. I'm trying. So with other pantries, we have had, right now, during COVID, we allow folks to drive through and obtain food, but then we also give them an option to say, hey, we need some more nutritional items, or for example, like Ensure for our older population, or for example, if they need any type of toiletries, any type of diapers or milk, we try to provide that as well to give them a full pantry experience, especially if they're in need. As our slide was stating, we carry dry goods, bread, milk, eggs, personal hygiene items, which are things that we get from the food bank, from food drives, and also from the community as well. We work very closely with a program called Porch that basically recruits neighborhoods in the area to collect food on a monthly basis, and they also drop off once a month to us, which has been very beneficial. So on average, we serve about 170 households a month, or a little bit more depending on the specific month and the need of folks. Next slide, please. Education-wise, so we do provide educational workshops that are specifically tailored to the theme that you may need, or the subject matter that you may need. We have HIV, STI 101 and consent. We have LGBTQ plus sex education, and then we do have other workshops that are in the work. We've done tailored workshops for Interact, which is a local agency that helps individuals that have been victims of domestic violence. So we basically are able to tailor any of our educational workshops and provide, any type of service that agency may need. We've also been able to do educational workshops in rest homes, and we've been able to tailor our workshops to be able to hit those demographics, just because it's not the same type of education for different age groups. Next slide, please. All right, and so part of our testing efforts are that we do provide referrals for PrEP. And so I will have my prevention specialist, Christian Arroguin, speak about, my apologies, my prevention specialist, Sergio Benitez Saga, to speak about our PrEP and teleprep programs that we have available.
Okay. So as Alma was saying, we do help and try to assist people with PrEP. We have two systems we use, or two ways we use in order to get people onto PrEP and to get them connected to PrEP. One of them is our regular system of when they come into the office. So I'm just going to start on that end. The Alliance of AIDS Services Carolina partners with pharmacies and clinics alike in order to make PrEP affordable and accessible to those with insurance and without. Our main goal is to make PrEP accessible to high-risk members susceptible to HIV or AIDS. And as testers, we begin the process and linkage to providing PrEP for our clients. So it starts with us in the office. And so what the process basically is we have someone come in, they get tested. We see and try to counter the risk factors that potentially could expose them to HIV or AIDS or other STIs. And if we can consider them a candidate, we offer them that opportunity to get on PrEP. And so through our partnership with pharmacies and hospitals and other sites, we can offer them the opportunity to make it to little to no cost at all. And so we basically have them sign up in the office. We send out the information. We send out their testing results and information and have them show up to an appointment. And so they go to the appointment. They get a little bit more work done. And then after that, if they don't have insurance, we try to work it to where, like I said, they pay nothing out of pocket for that, and make it affordable to them that way. I'm sorry, I got distracted. And so we make it affordable to them that way. And then after their appointments, the pharmacy can directly deliver their medication to them. The other way we do as well, it recently just started, was our teleprep program, which is online. And so basically we've put out ads either on I don't want to call them sex apps, but like apps like Grindr, Scruff, apps like that usually target community members at high risk, which are usually, unfortunately, MSM or men who have sex with men. And so we put ads out either on Grindr, Scruff, put ads on Facebook, Instagram. And so people see it, click on it, get connected to a link where they can sign up, put their information in. And so then me, as a person who is in charge of that program now, I reach out to them, give them that nudge, because it does sometimes, it's scary for people, especially with those without insurance. It's scary for them. So try to give them that nudge and that counseling in order to get them to sign up and go through with their appointments. And so after they've gone through with their appointments, they get as well their medication delivered to them at home. And the greater part, the thing that I love about that teleprep part too, is they get a kit sent to them at home. So as soon as they sign up, they get a kit. They can do it at home without, I know there's that fear of they're gonna see me getting tested. My family members, I'm not out to them and they're gonna see me go to this place and get tested, or their friends. So it's a more private way to do it. And it's I feel like a better way, especially now during a time where COVID is around and people are scared of getting COVID. It's very good for them to do this in the comfort of their own home. And especially when we have so many people at risk of getting HIV. But yeah, so that entails what our PrEP program is, and our teleprep program is as well.
Thank you, Sergio. All right, next slide, please. And our final program that we'd like to talk to you about, we are in the process of starting it within the next week, and it is our at-home testing program, which I will have my prevention specialist, Christian Arubin, speak on that and let you know exactly how that's going to work and exactly what we're doing to implement it and to, really be able to provide this service more conveniently in home for our clients.
Hi, my name's Christian. Like Alma was saying, we are really excited about launching this in-home testing program. I have at the top, know your status from the comfort of your own home. Like Sergio was talking about, our telehealth, our teleprep, we want to be able to get clients in that are not able to come into the office. So we want to bring something to them. So we had about 75 OraQuick in-home rapid test kits that were donated to them. They require no blood and reveal results within 20 minutes with just an oral swab of your upper and lower gums. We made it easy as clicking a link on our website whenever we do launch our program, or scanning a QR code with your phone. And that it goes straight to our client form. And once you submit it, we give you a call, verify your information, talk a little about what the program entails, and then we go ahead and send your test kit by mail. And what the test kit includes is of course, our rapid test, our program documentation. It also includes condoms and additional resources and information about the services and the programs we offer as well for, or depending on the client. Throughout this in-home testing, we schedule an appointment. So when the package does get to the client, we go ahead and schedule them a call. We give them a call, and there we go over, we ensure that we assist them to ensure that they're properly doing the test. While waiting, myself or one of the prevention counselors will have our pre-test HIV counseling session, and then review the results with them after the 20 minutes. Like we do in the office, we will go over their risk behaviors. We'll have a brief HIV education session, talking about, how are the ways HIV is transmitted, as well as discuss ways to protect themselves. We also, like Sergio was saying, of course, we want to get everyone we can on PrEP, protect themselves. And so we do have, we will go over PrEP, try and get them on as a 340B agency. We have that ability to sign them up. And if they are insured or uninsured, so that they can be protected against HIV. We also answer any questions the client may have and provide additional resources, as well as let them know about other programs that we have going on that they may qualify for or may be interested in as well. And I believe—
Thank you very much.
Yep, absolutely.
So in a nutshell, those are the services, and that's the Alliance and the services we provide, and our work that we currently do. Thank you.
Thank you. I really appreciate that we have multiple members of the team here, right, present on the call, because it really shows that that collaborative nature of this work, and ultimately, right, relationships are what are going to help us end this epidemic, right, and any epidemic that comes after it. There are some questions already coming into the chat, and I have some questions for y'all as well. But before that, I wanted to go ahead and bring up our other speaker to share a little bit about some of the work that he's been doing at the Atlanta Harm Reduction Coalition, and some of the work that they've been doing around HIV self-testing. So I'll go ahead and pass the floor to Saul Sanchez. Thank you, Saul, for joining us. Please feel free to introduce yourself some more and tell us about the Atlanta Harm Reduction Coalition.
Hey, how's it going, everyone? My name is Saul Sanchez, and I'm a prevention specialist with the Atlanta Harm Reduction Coalition. Atlanta Harm Reduction is an organization that's been around since 1995, I believe. That's when it was finalized on paperwork. And their main thing is trying to meet people where they're at and reducing the behaviors that cause them harm. So in that manner, their program for HIV prevention is similar to that. So most of what we do in the prevention team is meet people out where they're at. So we end up at bars, we end up at art shows, we end up at venues all over the city, just testing people, working with different organizations to try and get as many people tested as possible. Because like you guys said, it's very difficult to get somebody to come to a clinic specifically that tailors or tests for HIV or other STIs. We've been working throughout the pandemic. I think we took a total of like a month and a half or 2 months off at the very beginning. And thereafter, they provided us with safety protocols to go ahead and continue testing. When the numbers started going back up, they revisited the protocols, adjusted them, and then put in more safety measures for the team, such as glass barriers, more sanitizer, making sure that we limit the time that we spend with clients in any kind of closed environment. So as time has gone on and the material available to us has increased, I think we're constantly revisiting what it is that we can do to protect us as the specialists as well as the clients. So on that side as well, we have half of our team has received the first and second shot of the COVID vaccine. And then the other half is, for their own reasons, choosing to wait and see what happens. um, and so that means that half of our team is, I guess, at a 94% efficacy as far as not being able to contract COVID at the moment. Our clinic offers services as far as not just STI testing, but they also offer services for pregnancy testing. They also offer COVID testing. So they do offer that now as time has gone on and it's become such a necessity, and to increase the services that we provide for the community, because we tend to work in a community that is disparately influenced as far as like there's not a lot of clinics, hospitals, or food. So it's like a food wasteland as far as where the location that we're located in. We do offer testing, we do offer counseling, we do refer to different organizations for assistance with rent, travel services. There's also the Needle Exchange Program, which was the first program that was established, and that is where we go out into the community, 3 different locations depending on the day of the week, and we set up, offer needles in exchange for used needles so that we can go ahead and prevent the transmission of HIV and hepatitis C. We started about 4 months ago with the at-home testing. And with the at-home testing, I think there wasn't a lot of protocols as far as that was concerned. So we were kind of learning as we went along. When we first started giving out the at-home testing, we have paperwork that's tied to every test that we give out. So we were able to reach out to the different clients, but we also learned that some clients won't reach out back to us. So we had to get different protocols in place to make sure that we're able to get the results back, because sometimes people just don't want to call back. Also with at-home testing, sometimes people want to do it right there with us. So we'll have a tent set up in whatever location we're at. They'll go ahead and do the at-home testing because they don't like blood. We read the results, give it back to them, and there's no actual physical contact between tester or client. And I think those are the big things. I went through it pretty quickly. I apologize if I sounded a little rushed. Trying to hit all the major points, but if there's any questions, feel free to ask.
Absolutely. Thanks, Saud. So I'm gonna go ahead and invite back up our other speakers. If y'all want to turn on your video at the Alliance, and I can spotlight your accounts. I see phones ringing. I love it because y'all are doing this work, right? It's just a sign that y'all are live in the thick of it, and that's why I really wanted to bring y'all here and appreciate y'all. I see that Quentin actually has joined us as well. So Quentin, do you feel comfortable telling us a little bit about the Knights Orchids Society right now, or would you like a moment?
No, this works, Jose. Thank you so much for inviting me. I've just heard so much good information starting there about what other organizations are doing. And we're literally doing some of that same amazing work. Not wanting to reiterate or I guess go through and rehash a lot of what's already been said, but TKO is a black trans-led nonprofit. We operate pretty much smack dab in the middle of the South in Selma, Alabama. And our clients are a mix of TGNC people, MSM and queer people, and a bunch of low-income rural people. And what we've been able to do with our home testing program, as well as our wellness program, is actually be able to bring full spectrum, what we call full spectrum wellness to people to underserved communities who typically wouldn't have access to it any other way. So like some of the other programs have mentioned some of the things that they do. We also do, we provide HIV testing, chlamydia testing, gonorrhea, hepatitis C, trick testing. I think that's all of the chlamydia, gonorrhea. I think the big 7 tests that we do. And like most of the other organizations, we also do some of our tests are done with dry spot blood, and then some tests we do with the oral quick. We use the rapid oral swab, and then we also have access to the biolytical, the INSTI test. We seldom use the INSTI test out in the field. For us, it just creates a lot more issue with collecting the sample. But what we've seen with using our at-home test kits or our home testing system is that the dry spot blood works pretty well. People are afraid of needles, and when you say blood, a lot of times they associate that with sorry about that for going so fast. Sometimes they associate that with needles. So for us, the dry spot blood works pretty well. It is a finger stick, and with us, we're able to get the results back within 48 hours, which is a major advantage for us. Where some other organizations are having to wait a week or so, we can get a pretty fast, we can get a pretty quick turnaround with our dry spot blood test. And typically, if we have a client who has some high risk factors, then we'll typically go out with us. We'll take that home testing kit in the field with us. If we're doing an in-person meeting, or if they order it at home, they have the option to have a supervised visit or an unsupervised testing visit. So we kind of have those options there for folks. But if we have somebody that we're testing who's high risk in the field, we typically go ahead and use that dry spot blood test just because it is easier for us, and we get a quicker turnaround. Once our clients get their test results, we're able to refer them directly to a primary care physician who can either advise them about PrEP access, or if they are positive, we can directly link them to a physician who can start at that point, begin to get them on an ART regimen that's going to be effective for them. So what we try to do is pretty much center our wellness program around the needs of our TGNC and MSM clients, or our queer clients, because we don't have a lot of places in Alabama where people can typically get the wellness services that they need that are based on their transition related care. What we've noticed is that a lot of organizations provide utility support. A lot of organizations provide food assistance. A lot of organizations will even help you to get PrEP. But the issue that we ran to in Alabama that we were having is that people were willing to offer our clients PrEP, but they weren't willing to help them with the cost of labs, the cost of maintaining that wellness care. So what we've decided to do this year with our FAITH program, which initially FAITH is an acronym for Fair Access and Transgender Healthcare. And this year we've changed that acronym to Fast, Affirming, Innovative Testing in Healthcare. And we did that because we know our program no longer is focused on HIV testing, but rather wellness. So what we've done this year with our program that is different is we created a wellness membership where our clients can sign up to be members of TKO to receive wellness services. And those wellness services will include everything from primary care visits to mental health visits to quarterly HIV and STI testing. And what we try to do to motivate our clients to receive that routine testing and get them in the habit of developing routine healthcare habits is we incentivize on the back end. We make it a reward-based system where our clients they can get stipends for attending monthly workshops, whether those workshops be about queer sex education and consent, or if those workshops are about filing for a name change or a gender marker change, or if those workshops even talk about PrEP. If you want to get PrEP and you're not sure if it's right for you, we have workshops. And we incentivize those workshops because we want people to get comfortable seeking care and get comfortable utilizing the care. I think another way that our program is different because we focus on TGNC clients. What I've heard throughout the South, from insurance agencies as well as from employers is that when it comes to healthcare, they aren't particularly concerned whether or not folks have access to HRT, and they're not particularly concerned if people have access to the surgeries that they need to save their lives. So we try to make sure that those things are prioritized in healthcare, just like picking up your medications, just like going to your appointments. When our clients come to us, the majority of our transgender clients want access to HRT. They want access to electrolysis. So we don't choose what services our clients have access to. We lay out a list of services that we provide that we think are relevant to having a holistic transition, and we make those services available. We just require that our first point of contact is through that HIV test. And because we operate on an HIV neutral continuum, we make sure that the minute that our client contacts us, that they understand that regardless of their HIV status, they're still going to have access to all the additional services that they need holistically regarding their transition, so that it's a beneficial journey for them. We don't want to just offer them healthcare that's not holistic, because for a transgender person, for us, having access to hormone therapy or hormone replacement therapy, having access to hormones is just as essential as checking your blood pressure, as making sure that you have a medication regimen for your mental health, or that you have a medication regimen for your diabetes. It's just as important. So I think the one way that our program is different, just slightly different from the amazing work that the other organizations are doing, is that we include hormone therapy and transition related services such as name changes and gender marker changes in our care, in addition to the HIV testing, the STI testing, the food pantry, and the essential support services that our folks provide. I'm so sorry if I was still going too fast, y'all.
Thank you, Quentin. Well, you know that our Latinos in the South program is a deep fan and admirer of the work that y'all are doing in Alabama and across the region. It's always a blessing to have you sharing just a snapshot of some of the work that y'all have been up to. I'm gonna go ahead and bring up our other roundtable participants to maybe have a group conversation now. And just talk a little bit more about how y'all see this work continuing forward. So something that I wanted to highlight while I give y'all a chance to review the questions, because there's been a few coming in and the questions and answers, and I see Sergio has been responding to them, so thank you, is that Saul had mentioned how they had done a home or self-testing program, and that during the recent months, what they did was they shifted from making it its own standalone service, so that now that the prevention specialists will carry home testing kits with them and just hand them out on a kind of case-by-case basis. And so I was interested in hearing from y'all how y'all were thinking about integrating this work into your services, how y'all see yourselves sustaining HIV self-testing into the future, and open that conversation up for anybody who might be listening that might want to start a self-testing program. And Saul, if you want to mention maybe even a little bit more about how that process went with like the kind of switch in your own agency, I think that'd be helpful.
So with us, during that time when we were required to only use the at-home testing, we handed in the paperwork to complete that's tied to every test that we have, which requires the demographic information as well as their contact information. Once we received that, we notated the information on the actual test so that we can keep track of which test was given to them. And then we let them go home. They did the test at home. They were required to give us a call or an email or a text message with the results back. And then if they didn't give us a call or send us the information back within a certain frame of time, then we reached out to them until we got the answer that we needed in order to finalize our paperwork. seemed to work for the majority of the time. We did have a couple of people whose information we were not able to reach, especially at the beginning, because they gave us false information, but that happens sometimes. So, but after that, we are required to verify information before they leave with the actual at-home test.
Yeah, I'd like to hear from TKO and Alliance what y'all are thinking as far as you're moving forward with your self-testing program. I know we're at different stages of development of the self-testing work, and definitely want this to be something that is just another tool in your toolbox, right? Rather than something that necessarily takes you away from some of your other work.
I completely agree. I love that that idea as well. Is verifying that information. And I was thinking about, I was like, yeah, that makes sense for us. We have that issue. We have a lot of people who come to us who are in the middle of changing their names. So it's also a constant conflict of which name do you use. So a lot of times for us, if it doesn't require us to put a birth name, then we use their preferred name. Especially if they're in the process of changing it. But that's always a thing, because you meet them and we do a lot of our outreach in the club. So we're testing the performers, we're testing the people who are constantly moving around. So it's kind of hard to pin that down, but that's smart to go ahead and have them verified before. We're gonna definitely start doing that. I think one of the other things that I think because we're very new into our home testing program. We initially wrote out to use the first quarter to try out a couple different strategies because we didn't know what was going to work. But what seems to be working for us the best is that when we have people come in who are new testing to us, we'll offer the at-home test kit. But sometimes the folks who are new, what we're seeing is that they want to test with somebody. They want a supervised test kit. But the people who are consistent testers with us, every 90 days, we make you an appointment after we test you. We already have an appointment locked in from 90 days from now, so that you can have that next test done. And what we're seeing is that when we're getting ready to do those 90-day referrals, we can just send out an at-home test kit to most of those people because they've tested with us before. They feel comfortable where they can do it themselves. And that oftentimes works for us. So if they're repeat testers, like, hey, your date's coming up. Do you want us just to ship you a kit this time? Do you want us to set you an appointment? Do you want us to meet you somewhere? And a lot of times for us, it's what works best for the client. Whatever works best for you, we'll get it out that way. But definitely, if they're a high-risk person, the only difference is we'll send a dry spot blood test home versus sending an OraQuick, a rapid test, because we all know that rapid test is going to require a confirmatory. So if they're high risk, we just send out that dry spot blood. And it's literally as simple as pricking their finger and then dropping blood in about 5 different spots on the card until it fills a circle. You put it back in the bag, the shipping and everything is in there, you drop it off, and we're able to access their results through the portal, back-end portal that they have. So in the event that they don't return the calls for us, we're still able to access the information and report on it.
So in terms of the Alliance, as I mentioned before, we are in the process of just rolling out our at-home testing program. Right now, the way that we envision this to work is that we are going to have folks, we're going to advertise on our social media pages and basically do mass advertising so that anybody that's interested can go ahead and order a test from us. And then from there, we're going to schedule a counseling session directly with that client. Through a HIPAA compliant telehealth program that we have. That not only will allow us to build that rapport with that client, but also allow us to make sure that the test is being run accurately. We don't foresee ourselves providing any at-home tests here in the office just because we're already well established enough and known in the community that if folks want to come in, we can just offer the minute rapid test here, or we can offer the 20-minute test, or even in the clubs, we have the option to be able to do that right then and there. One thing that we want to certainly keep in mind is that because the OraQuicks have in the past produced false positives, we have a 24-hour window where we're going to meet with this client and make sure that we have this appointment in place. And of course, I completely understand some folks do not adhere to the appointment, or they'll go ahead and run the test prior to us meeting with them. But that's where we're going to have them come in and sign up online with a client registration form that we have made so that we can have all their information, and they cannot proceed without us getting the consent and their information sent to us, so that if the client doesn't follow through, we know how to contact them or where to find them, which is something that we'll provide in the consent as well. Just because if there was a possible positive, we have 24 hours to get them in to do a confirmatory blood test and also a traditional test as well. And because we're a non-traditional office, we can basically meet the accommodations of the client. You know, if a client needs an 8 o'clock appointment at night, we can schedule it. If the client needs a weekend appointment or for us to go out, you know, and meet them at their home, we can certainly do that, provided, you know, we have PPE gear. We make sure we follow all safety protocols, make sure that we do that. Because right now that's what we have been doing, is if a client needs testing services and they're not able to come to us, we accommodate them, especially in these rural areas where we'll go out to them and meet them directly. So that's where we hope that we'll get more adherence. We hope that we'll be able to collect more data. And also our hope is that, you know, folks will be willing to come in and get those other tests that they may need, like syphilis, chlamydia, gonorrhea, because sometimes, you know, there's a lot of co-infections that occur. And so we want to make sure that we provide an all-around counseling session for that client. That also allows us to be able to connect them to PrEP right then and there, or we can do a PrEP referral out in the community or out in the field so that we can go ahead and try to get this person connected to anything that they may need so that they can be, you know, safe and on PrEP. With the teleprep program that we have, that's a perfect leeway for us to be able to refer folks out in the community. And so that's what we envision our at-home testing program to be, and how we're going to roll it out and expect, you know, hopefully more adherence. And I know there was a question about the confirmatory test. And again, like I said, we do have a 24-hour window period where we're going to follow up with these folks. And Christian is going to be in charge of the test itself, because I figured it's easier to have one person that can build that rapport with folks and that can, you know, reach out to them, and that way they know that one face, so that they know they can trust them, and that, you know, any services, any other services they may need, they can come to us.
Thank you for that. And one of our hopes is definitely that we're building a learning community and a community of support, right? So our other presenters from the week, some of them are on this call right now. I hope you will turn to each other, right, to ask each other for support when building out your programming, and when you have questions around how to do some of this work moving forward. And we did get a couple of questions that you answered the one about confirmatory testing. But wanted to ask this one that was from Dr. Cheryl Johnson, who was our presenter during our first day, which was a general question to all of you about how to balance the desire for data with being able to make sure that people feel safe and have a confidential testing experience, right? Just if you all have any best practices or things that y'all have been doing to be able to address that, would love to hear for our audience. I mean, that's open to anybody.
I think that's always a challenging issue, is knowing the amount of paperwork that comes with tracking the HIV test, and then knowing how comfortable your client is going to be with disclosing all of that information. I was at a complete shock to know that our state serology reporting form went from 2 pages to 5 pages. And they literally want to know information about navigation services. Did you refer clients who were negative? Did you refer clients who were positive? Did you call partner services? Did you reach out to their mom's cousin and see if they were home Thursday? It's a lot of information. It's a lot of information. And they have this no blank policy. And I think they don't understand how much time and trust you have to build in order to get that level of information from a client. I don't think they understand how much work that takes. So what we've been trying to put into practice is to really study the questions that are on the form. If at all possible, as much information as we can get the client to fill out themselves, that's how we've been getting the most information. So we went from having a testing and counseling form that was separate. Excuse me. One of my staff members got sick. But we try to manage it. We look at the form and see what we can ask the client to put in, and Can y'all hear me?
Yeah, and it's okay if you need to take a moment, Quentin.
Yeah.
No worries.
Oh my
No
God.
worries. We understand you're on the front lines right there. So maybe Saul or somebody from the Alliance, if you would like to offer some thoughts on balancing data with confidentiality.
It's an interesting dilemma, right? You have to balance the whole idea of collecting the information for the paperwork, for the grants, for the funding that you are required to do, as well as balance the need of the client as far as them wanting to know their status without actually having to give away any information where they can be tracked. So it's a developing rapport and building relationships. We visit a lot of the same locations. Our prevention team is made up of 6 different individuals, and we're located throughout the city. We're in sex clubs, we're outside of bars, we're in art galleries, we're working with the Needle Exchange program. So a lot of our faces are getting well known and people have learned to kind of trust us. But for those people who don't quite know us, it's like he was saying earlier, it's about knowing your questions. When people come up and they're like, why do you need to know this? It's about being able to give the correct response as far as, in order for us to give this test for free, there's certain requirements by the city or the organization that's providing the funding that they are needing some demographic information so they can target the program specifically. Most of the time that's enough to get people to go continue with the questions, but also if they don't completely fill it out because they're not comfortable, what I've learned to do is just have a conversation with people. And as I'm talking to them, just make note of any questions that they may not have answered so that I can go ahead and fill it in to the best of my ability, anything that they didn't quite fill in on their own, so that everything is completed to the best without going above and beyond and still being able to give them a good client experience, I guess. Because for me, I know sometimes a question about there's a question about how much money do you make in a year? And most people are generally uncomfortable with that question. So if you just ask, if in the conversation you have that question and you're like, so I'm about how much money, you can phrase it a lot of different ways and still get a response to that question. And you can move on from then and then just go on to the next thing that you need to do. I don't know. I think I went long-winded and didn't quite answer that, but that's the way I would have approached it.
Definitely. And while Sergio, I saw you turn on, just also wanted to tack on this other question about if you wanted to talk about being able to provide their home address as well.
So as the person in charge of the prep coordination program, so I basically, when they sign up for the teleprep, I have a portal where I can see all their information. And really, when it comes to data, the only information we really require is obviously their name, date of birth, gender at birth, contact information, whether that be email, phone number, and then we do require their address, unfortunately, and that's just so we can send kits. We also, we don't ask for documentation at all. And a lot of those fields, we do ask for their social security, but it's optional. It's not necessary. A lot of, in those fields, a lot of those are optional. If it feels like it's a privacy breach, we do leave that option for them to just leave it blank, but we just really do ask for address, phone number, a way to contact them, because if I can't contact you and let's say an opportunity arises for you, I'm doing a disservice to you by not being able to have a way to reach out to you. And one of the ways that we keep people, I guess, connected and up to, I guess, keeping them in reach with us is we either use HIPAA compliant methods to contact them. So whether that be text message, email, or phone calls, and then that way we can stay in the loop. And Alma mentioned earlier, we usually have just one person reaching out to that person. That way that relationship can build and we can have them in a space where they are comfortable. Even if it's not in our office, they're still in a space and in a environment where they're comfortable to reach out to just one person if need be. it's a struggle with the data, because we do have people that just are on the fringes sometimes and do not, they want no way of anybody knowing that, you know, they're trying to get on this medication that is, you know, stigmatized as being someone of a disease that only homosexuals get, or, you know, or a disease that, you know, is stigmatized with certain behaviors that are not considered good behaviors.
Excellent.
Mm-hmm. And one thing I want to add with our at-home testing program, one thing that we have gotten is that we actually had kits donated to us. And so a lot of it too falls in line with the need for data collection and reporting. Reporting is important regardless, but it was more of unrestricted test that we had. But part of it is because we're running the test and we're providing a counseling session, that person does have to authorize us to be able to not only send them the test, but also to be able to give them that counseling session. And I think it's important to build that rapport, as Saul mentioned, as we've mentioned in the past, because one thing that we've noticed is with PrEP, we've seen an increase in PrEP and follow through because we do those text messages, we do that email, we do that direct contact with just one person that they know, that's going to be like their coordinator through the whole process. So our at-home testing program, we envision that to be able to say, okay, we understand you have concerns, but we also need to know, you need to know that for us to be able to follow up with you in case something were to come back positive, we need to build that relationship with you. We need to be able to have your information. We need to make you understand that it's confidential, but it's not anonymous. So that's one thing that we like to center on, and even with any other service that we provide in the office or out in the field. And like I said, we have a really good rapport in the community with folks being able to trust us. And of course, you know, we understand, you know, that we're going to come in contact with somebody that may not give us information, but, you know, unfortunately, because it's required for us to be able to follow up, we want to make sure that we understand that, you know, we're here to help them as much as possible.